Good morning, afternoon, and evening, everyone. Thank you all for joining today's webinar titled What Matters for Sustainable Diets? Results of a Global Expert Elicitation Across Environmental, Social, Health, and Economic Domains. My name is Maha Sheikh, and I am the Communication Specialist for the Food Systems for Nutrition Innovation Lab. As more attendees are joining the webinar, I will begin by going over some of the logistical items. I would like to direct all attendees to a few functions on this Zoom call. At the bottom of your screen, you should see a chat icon and a Q&A icon. Please use the chat feature to engage in relevant conversation with the other attendees, and also feel free to introduce yourself. If you have a question for one of our panelists, please use the Q&A feature. We have allotted the final 15 minutes of this webinar for Q&A, at which point the panelists will respond to any questions that come in from the audience. This webinar is being recorded and will be made available on our website following the event. We will continue to repeat these technical housekeeping items in the chat throughout the webinar as people may be joining in at later times. Next, please. It is now my pleasure to introduce Dr. Shabani Ghosh, the moderator for today's session. Dr. Shabani Ghosh is a Research Associate Professor at the Friedman School of Nutrition, Science, and Policy at Tufts University, and is the Director of both the Food Systems for Nutrition Innovation Lab and the Georgia Nutrition Innovation Lab. With a focus on examining malnutrition in all its forms, Dr. Ghosh designs and implements rigorous research to generate evidence and identify actors for program and policy recommendation. She has published extensively, is co-chair of the Global Nutrition Report, former Innovation Lab Council Chair, and an expert on committees convened by the United Nations Food Agriculture Organization, the U.S. National Academies of Science, Engineering, and Medicine, and the U.S. National Institutes of Health. Shabani, over to you.
Thank you, Maha, and welcome everybody. This is going to be a very exciting webinar. As Maha outlined, this is really a session that's going to bring together experts who are going to talk about the work they have been doing around trying to elucidate what is really critical in what are the critical metrics required for elucidating sustainable and healthy diets. As we all know, sustainable dietary patterns need to be environmentally sound, socially equitable, economically viable, and nutritionally adequate for our current generations, but also our future generations. So the work that the Lasting Project, led by Nicole, Tichenor, Blackstone, is really critically looking at questions that are going to be important, not just in the United States, but also globally. So let me take this moment to introduce all the speakers of today's webinar. Firstly, we have Dr. Nicole Tichenor Blackstone. She is an assistant professor at the Friedman School of Nutrition Science and Policy at Tufts University. She's a sustainability scientist who studies the environmental and social impacts of food systems innovations, interventions, and policies. She leads the Lasting Project, which is leading a sustainability transition in nutrition globally, which aims to produce evidence-based recommendations, models, and data for integrated sustainability assessment of diets. Dr. Blackstone is also the founding and affiliated faculty member of the Tufts University Center for Cellular Agriculture. She leads and co-leads several projects focused on environmental and social implications of cultivated meat. Our second speaker today is Dr. Sean Cash. He is the Bergstrom Foundation Professor of Global Nutrition and the chair of the Division of Agriculture, Food and Environment at the Friedman School. He is an economist who teaches and conducts research on food, nutrition behavior, agriculture, and the environment. His research focuses on how food and nutrition and environmental interventions and policies affect both consumers as well as producers. He has conducted research in sustainable food systems, including projects on climate change, coffee and tea production, cellular agriculture, and invasive species management. Our third speaker today is Dr. Catherine Fuller. She is an assistant professor in the Applied Economics Department at the College of Agricultural Sciences at Oregon State University. Her research analyzes consumer acceptance and willingness to pay for food labels and novel food products. Her research interests focus on the efficacy of food labels and their impact on farmer livelihoods, consumer interest in cellular agriculture, and food labeling for ethical and environmental purposes. She also analyzes socio-demographic factors that influence consumer decisions to purchase sustainable products. I'm really excited to have these two of my colleagues from Friedman School, along with their collaborators, presenting on an extremely critical and important topic within the context of food systems transformation. With that, I'd like to invite Nicole to please come forward to start the presentation. Nicole, over to you.
Thank you so much, Shivani. Let me just get my screen set up. All right, so it is a pleasure to be here with you all this morning, afternoon, or evening, depending on where you are in the world. We are really looking forward to sharing some of the results that we have from our lasting project focused on an expert elicitation for what matters for sustainable diets. So we're talking about sustainable diets, but it's important to recognize and acknowledge that when we think about the food that we consume as part of a dietary pattern, really what we're thinking about and analyzing is the whole set of transactions, relationships, resource use, and emissions that are happening along an entire value chain. And so when we talk about sustainable diets and the impacts of sustainable diets, really we're thinking about the culmination of all of these activities and impacts along a full value chain. So if you will, for a minute, humor me, and I want you to consider an apple. When we eat an apple, there is a whole host of resources that are used along the value chain to get that apple to our plates. This could include things like water. Um, there is pollution that's produced along the entire value chain. Some of that pollution can affect human health or it can affect ecosystems. Um, in addition to affecting human health, right, we have waste occurring along value chains as well. That waste could be plastic, it could be cardboard, metal, all different kinds of materials. Some of that waste could be recycled. Some of that waste could be put in a landfill. It could be incinerated. All of these things have different implications for the environment and human health. Also along the value chain, there are people, right? There are people laboring, harvesting, distributing, transporting foods along the value chain, growing foods, people consuming foods, producing foods, and conditions that our food producers and workers may be laboring or producing could be more or less fair, could be more or less profitable. Um, and when we think about within a food value chain, there's this issue of profitability too, and livelihoods for producers, as well as the affordability of this food for consumers across income levels. And for this apple, when you eat this apple, right, this could have benefits for your health, right? This could be helping with your cardiometabolic conditions. It could be helping contribute really important micronutrients to your diet, fiber to your diet, have health benefits, et cetera. It could be helping you maintain a healthy weight. So when we think about an apple and eating an apple is really all of these things tied up together. And this, in the lasting project, we think about this as the 4 different pillars of sustainability, which I'll talk more about, social, economic, environmental, and health. And also, it's important to recognize that when we think about this apple, and we eat a lot, maybe we eat a lot of apples, we eat all of the foods that we eat in the context of our dietary patterns. When we add all of this up, it turns out to have a really significant impact on the world. So at a global level, right, we know that for health, diets account for 20% of premature disease-mediated mortality worldwide. Over 3 billion people suffer from one or more manifestations of poor nutrition. That could be undernutrition, micronutrient deficiencies, or overweight or obesity. And in the US specifically, which is the context in which we do a lot of our work presently on the Lasting Project, we know that current US diets and Western diets generally are linked to high rates of preventable cancer, heart disease, stroke, and diabetes outcomes. So significant health impacts when we add up all the foods that we eat at the global level and at the level of the US. On the environmental side, we know that the current food systems create tremendous environmental pressures all over the world, ranging from climate change to significant land use, biodiversity loss, freshwater use, nitrogen and phosphorus use, et cetera. And at current consumption rates, we're already succeeding or exceeding sustainable levels for things like greenhouse gas emissions, nitrogen and phosphorus application. But if we look to 2050, in the absence of mitigation measures, we are going to far exceed sustainable levels of use and boundaries for the planet. And so it's very clear that things need to change in the food system, and diets are a key piece of that. I mentioned health and economic and environmental aspects. What about the social and economic aspects of our food systems? Right, we know that in food value chains and in agri-food systems, it's a tremendous employer globally. So there are over 1 billion people employed in food systems, thanks to recent data from the FAO. And within food systems, that employment is by no means fair or decent or equitable. We know that the agriculture, forestry, and fishing sector has one of the highest rates of forced labor among all global sectors. In the US specifically, we've done some work looking at this and risk of forced labor, and there's a high level of forced labor risk in the US food system specifically. Thinking about economic sustainability of food systems, we know that 1/3 of the global population can't afford a healthy diet, and 60% of the folks that can't afford a healthy diet reside in low and middle income countries. So this is a global equity problem as well. Sustainable and healthy diets are out of reach for far too many people over the world. So we know that food systems must transform. And when we think about food systems transformation, as Shabani mentioned, in the environmental space, I'm thinking about planetary boundaries, sustainable and healthy food systems. We typically talk about 3 different sets of strategies for food systems transformations to remain within planetary boundaries. These are including improving the ecological efficiency of agriculture, reducing food waste and loss along the value chain, and shifting diets. And so the research that we are going to present and focus on lives under this umbrella of food systems transformation, where we're really interested in how we can shift dietary patterns to advance health and sustainability. And so the work that we're presenting is part of the Lasting Project, which, as Shabani mentioned, stands for Leading a Sustainability Transition in Nutrition Globally. We are an interdisciplinary team of economists, sustainability scientists, geographers, labor experts, nutrition epidemiologists at Tufts and across multiple institutions in the US and the UK. And we are really focused as a team on creating evidence-based recommendations, methods, and metrics for integrated sustainability assessment of dietary patterns. And as I mentioned, our view of sustainability has 4 domains or 4 pillars: environment, health, economic, and social. Sean will talk more about how we operationalize those pillars in the context of the expert elicitation, but I want to present the overall framework that we're working within as the Lasting Project. I'll also say that Lasting does more than the work that we are presenting today. We also do work on modeling dietary shifts and dietary patterns. And if you're interested in learning more about that, you can check out our website. So we are talking about what it means to have a sustainable, healthy diet. And Sean and Kathy will discuss what we learned from experts across the world about what matters when we measure sustainable, healthy diets. But first, I want to ground us before we get into some of our empirical findings, what it means from FAO's perspective to have a healthy, sustainable diet, because it really does align with how we've operationalized this in the context of our project. So FAO defines sustainable, healthy diets as patterns that promote all dimensions of health and well-being for individuals. They have low environmental pressures and impact. They're accessible, affordable, safe, and equitable, and they're culturally acceptable. And something that I will add that we are really keen on and that we have been doing a lot of work in as part of the Lasting Project is this last phrase, affordable, safe, and equitable, and culturally acceptable. So when we think about equity, cultural acceptability, and these sorts of things, fairness, we think about this across the whole value chain, not just equitable for consumers, but equitable and fair for workers, farmers, businesses in food value chains, et cetera. So we're taking this whole systems perspective. And I will now pass it over to Sean to share more about the empirical work that we've done in this space. Over to you, Sean.
Thanks very much, Nicole. Next slide, please. As Dr. Blackstone described, a primary goal of lasting is to identify appropriate metrics for measuring the sustainability of diets across the 4 pillars of environmental, health, economic, and social sustainability. One of our team's major undertakings in this was to conduct a thorough review of the literature to see what the metrics have been used and employed in other studies that similarly looked across different pillars of sustainability. Our inclusion criteria for this included any paper published between 2015 and 2021 that considered dietary patterns across at least 2 of these 4 pillars and involved some sort of actual measurement rather than just proposed conceptual frameworks. Our team published the results of this review last year, and the findings of that review also form the basis of the expert elicitation, which is why I'm talking about this right now. The paper was published open access, and I'd encourage anyone who is interested to take a look, as I only have time to discuss the results in broad strokes today, and mostly just the extent that it informs the methodology for our expert elicitation. Next slide, please. So Nicole already introduced these 4 pillars, but as our goal in this literature review was to review all of the relevant literature, we had to take into account the fact that the previous work was not necessarily informed by our specific formulation of the 4-pillar approach to sustainability. So we had to define each pillar explicitly so that we could categorize the metrics used in previous studies appropriately. So here you'll see the definitions we use, which were really just fleshing out what Dr. Blackstone already shared a few moments ago. But specifically, we defined health outcomes as being those related to disease or human well-being associated with meeting nutrient needs, supporting physiological and cognitive growth and development, and promoting wellness. Environmental sustainability, defined as the impacts on climate, ecosystems, and natural resources resulting from the production, distribution, consumption, and disposal of food commodities and products. Social sustainability, this is a tough one to define, but we're pretty happy with the definition we got to. The underlying conditions within and the impacts of food supply chains on stakeholders who are directly or indirectly affected by food system functions. And then finally, economic, which includes not just affordability and access to desired foods, but relative food prices, the cost of policy actions, and the viability of supply chains and institutions that support all food system functions. So that would include things like profit for different stakeholders who are involved in formal markets, et cetera. If they can't keep doing what they're doing, then obviously that's not a sustainable system. Next slide, please. So for consistency and replicability in our review, we included all the metrics that met our definitions, regardless of whether the authors of those papers classified them in the same way. And when we looked at the primary locations in which these multi-pillar studies were conducted, again, by which I mean that people were looking at outcomes in at least 2 of the 4 pillars as we've defined, we see really heavy representation from North America and Western Europe in that scientific literature, and fairly limited representation from elsewhere. Next slide, please. We also saw a clear trend toward more consideration of multi-pillar work in more recent years, which we find really a positive development, with most of those papers covering either environmental and health outcomes or environmental and economic outcomes. The inclusion of social outcomes as we define them in multi-pillar studies, such as, for example, social and environmental metrics of dietary patterns, is pretty rare across the entire period of our study. Of course, our systematic review also summarizes what the specific measures are that have been used in these previous studies, but in the interest of time, I won't describe that in detail today. It includes some obvious ones like greenhouse gas emissions mentioned in CO2 equivalents as an environmental measure, but also turned up some innovative and creative ones as well, such as attempts to quantify the acceptability of taste of food products. Next slide, please. So across the scoping review that we conducted, we found a small but growing number of analyses that encompassed interactions across at least 2 of our 4 pillars of sustainability, but very few tackled 3 pillars, and actually no papers were identified in our review that included measurement across all 4 pillars of sustainability. Now, as Nicole already mentioned, we do have some modeling projects going on in other parts of our lasting work. We're actually finalizing what we believe is the first paper to include measurements of sustainability of dietary patterns across all 4 pillars of sustainability. But that's not ready to share, and it's not the focus of our presentation today. Hopefully we can share that soon. Next slide. So now coming more directly to our expert elicitation. Our systematic review tells us what researchers have looked at in the past, but that doesn't tell us what we should be looking at or what we should consider to be most important. Indeed, a lot of the metrics used in previous studies were used in large part simply because the data needed to construct them existed. In order to investigate what might be most important and to identify what our collective goals around measurement of sustainable diets and dietary patterns should be, we embarked on a global elicitation of experts. Specifically, the questions we were looking to engage our expert panel on were: 1, what are the necessary outcomes to consider when analyzing the impact of dietary patterns from a multidimensional sustainability perspective? And 2, what are the perceived importance and prioritization of these outcomes among experts? In other words, if we really want to be able to understand if we are consuming more sustainable diets or where we need the most improvement, how should we be tracking our progress towards those goals? Next slide, please. So the general approach we used here to answer these questions is what's called a modified Delphi approach. So the Delphi technique, named after the oracle at Delphi, is an approach where you answer a research question by identifying a consensus or trying to get toward a consensus point of view across experts regarding a specific topic. In cases where the evidence remains inadequately explored for a particular subject, such as this multi-pillar approach to sustainable diets, the collective opinion of experts can offer significant value. So using iterative rounds of surveys, participants in a Delphi approach are asked to rate the importance of outcomes or selected metrics in our case. After each round, the responses are analyzed and anonymously fed back to the same participants in the subsequent round, where participants reflect on the views of others depicted by those rankings. Given the insights of their peers, they can re-rate each item, in which case their initial responses may change or could remain the same. While 2 rounds of evaluation with feedback are the minimum in Delphi approaches, additional rounds are often required to develop a consensus or to answer the research question, and here we did need more than 2 rounds. So also in our review of the literature to date, we noticed a real notable lack of expertise from low and middle income countries, and also only limited coverage of the social and health pillars in these studies. So we wanted to make sure to construct our expert elicitation in a way that would increase the representation of and input from experts from these underrepresented geographies and areas of expertise. Next slide, please. So to address these areas of underrepresentation in the existing literature, we spend quite a bit of time trying to look at best practices for increasing the inclusivity and representativeness in our study. Our scan of the literature from previous Delphi studies indicated that this has often not been an explicit concern in many Delphi panels. But fortunately, we were able to find a few good examples as well as methodological commentaries to provide our team with some guidance to inform our stated goals of increasing the regions of the world represented in our sample, as well as the breadth of content expertise that we could include. Next slide, please. So as suggested in particular by 2 great papers, one by Donahue in 2011, another one by Mukherjee and others in 2015 that we're happy to share with anyone interested in the methodological aspects of this, we designed a screener questionnaire in which participants had to self-report at least one of the following minimum requirements. We're looking for evidence of professional productivity in terms of participation in academic or multilateral symposia relevant to food systems and sustainability. Or we wanted to see at least 5 years of current or previous experience in the public or governmental sector related to sustainability of dietary patterns. Or at least 5 years of current or previous experience in the private sector related to these topics. Or at least 5 years of teaching or extension related to these topics. And finally, another way of qualifying as an expert for our panel was evidence of indigenous knowledge as illustrated by participation in multilateral symposia, or 5 years of leadership experience with an indigenous group, community, or other entity related to these topics. So this was our attempt to really make sure that we were getting at different ways of knowing and having a broader set of expertise than what we had just seen in terms of the authors of this previous literature in the scientific studies that we reviewed previously. Next slide, please. So we had a 3-stage approach to our Delphi panel. After we completed the screening and recruitment, the first stage of the panel invited experts to rate the importance of those outcomes we identified in the systematic review on sustainability of dietary patterns. But we also invited our experts to propose outcomes that they considered to be ignored in the literature. So those we thought of as the expert proposed outcomes. So for in the systematic review, we had seen the environmental domain had the most outcomes with 31, and then a fair amount for health, fewer for economic and social. So we wanted to let experts give us a wish list of what they thought might be most important. In the second stage of our Delphi approach, the experts were asked to re-rate the outcomes that they initially rated that had been culled from the systematic review. They were also then, so in that re-rating, they're given the average ratings of all the panelists as well as reminded of their own rating. And then they were also invited to rate new outcomes that had been proposed by their peers in the previous stage. So we also made sure as a team to go through those expert proposed outcomes to just eliminate any overlap to make sure we weren't just talking about the same thing with slightly different words. We also included additional outcomes for the social domain because there weren't very many that were proposed there, where we used International Label Organization's Decent Work Indicator framework, as well as the guidelines for social life cycle assessment of products. So these are 2 previously published and well-established frameworks to help identify additional social outcomes and metrics that could be considered by our panel. And finally, in the third stage, experts were invited to re-rate the outcomes that had been proposed by the experts. So basically, everyone had the opportunity to rate all outcomes twice. And they were also provided with the average rating of those panelists from that and reminded their own ratings again. Finally, they were asked to assess and the weights of the importance of the 4 domains in total, and were given the opportunity to reflect on that, looking at their peers' ratings for that as well. Finally, the study finished by asking experts to provide insights about the top outcomes with the lowest level of agreement, so we could better understand those areas where we were not approaching consensus. Next slide, please. So here's an example of the actual rating exercises that were posed to our experts across the 3 rounds of the Delphi study. I personally find it a lot easier to see examples to make this more concrete. So for example, here, exposure to food contaminants was one of the proposed metrics for assessing the health sustainability of diets. We just put that out there to all the experts. We didn't say we thought this was important. Rather, we asked them, do you think that this is important or not? They could rate that on a 5-point scale from not important at all to extremely important, or they could specify if they didn't feel that they were able to rate a particular candidate metric. In subsequent rounds, each expert is going to be shown these same things again, and as well as the average importance rating from the whole panel from the prior round, and also reminded how they had previously rated the outcome, and they could either keep the same rating that they had before, or they could choose to change it. The point here, or the idea, is to allow the panel to move toward harmonization through iterative ratings, but without forcing anyone to do so. Not only does this provide results that are more likely to approximate some sort of consensus, but it also allows us as a research team to quantify the extent of what might be considered to be intentional or at least informed disagreement within the panel. We don't have time to go through a full description of the rating instruments across the various rounds of our panel, but of course, we're happy to share the completed instrument upon request in a few weeks, as soon as our write-up of this study is finalized. Next slide, please. So for each of the 4 pillars of health, environment, economic, and social aspects of sustainable diets, our experts ended up rating both the metrics that we identified as having been previously used, again, through our published literature review, as well as those that have been proposed by the members of our expert panel in the earlier rounds of the Delphi panel. So here, for example, you can see the 83 candidate metrics that were rated by the experts who participated in the health pillar ratings. Keep in mind that each expert was given the opportunity to rate each of these candidate metrics, what we called outcomes, twice. And the second time, it's with knowledge of the average rating from the previous round. Next slide. For the environment pillar, here are the 52 candidate outcomes that our experts were asked to rate. This was really a lot of work from our experts. We really appreciate their attentiveness and the time they gave us. Next slide. We should be on one called economic outcomes. Thank you. For the economic pillar, candidates were invited to rate the importance of measuring these 24 candidate outcomes. And next slide. Finally, for the social pillar, our experts were asked to rate the importance of these 38 outcomes. And as I mentioned, this also included some additional ones from outside of the panel from these well-established guidelines to make sure we had broader representation of candidate outcomes here. So I realize this was fairly fast, but I hope this provides at least a general understanding of how we conducted our expert elicitation into how we should measure sustainable diets. I'm now going to hand things over to my colleague, Dr. Kathy Fuller, who's going to tell you a bit about what we actually learned through all of this. Go ahead, Kathy.
Thank you, Dr. Blackstone and Dr. Cash, for introducing this research project. I am excited to share with you all today the results of this exciting project and the plans that we have for the future that are already in the making. So Sean mentioned the 3 stages, which ended up in 2 rounds of the Delphi study. This means that our experts rated the outcomes an initial time and then re-rate the outcomes one final time. In that final round, we also asked them to rate the importance of the 4 domains of sustainability. We had a panel of 60 experts worldwide who went through all the stages and gave us feedback at the end of the study. I want to start with this study's representation. We asked participants which domain or domains of sustainability represented their areas of expertise. They could choose more than one, so they could be experts in 1, 2, 3, or the 4 domains. And 24 participants selected the economic domain, 30 the environment domain, 39 the health domain, and 22 the social domain. Next slide. The representation we achieved in terms of continent participation is shown here. We asked the expert panel what continental region they most identify with personally, to which 33% identify with the continent of Africa, followed by 25% with Europe, 20% with North America, 12% with Asia, 7% with Oceania, and 3% with South America. We were thrilled to have participants from all around, from all the continents at the end of the study. We didn't want to lose the perspective of anybody in any continent. Next slide. Now, in terms of the representation by area of work and answering the question, please select your area of work, we gave them the options that you see displayed here. And we let them select all that apply. We had 35 experts working on research and extension, 34 working in teaching or academia, 16 in the public of governmental sector, 15 working in non-governmental organizations, 11 working in the private sector or consultancy, and 2 who did research or had leadership on Indigenous studies. Again, we were very happy to see that all areas of work were represented at the end of the study. Next slide. In terms of the outcomes, I will show you the outcomes we call SRO, which came from the systematic review that Sean referred previously, and the EPO, which came from the experts. From the environment domain, we had 52 outcomes. Health had 83 outcomes, economic 24, and social 38 outcomes. This means that a health expert would rate the importance of 83 outcomes, for example. Next slide. Now I'll present the outcome results by domain. I'll present the top 5 highest rated outcomes for each domain. These include all the outcomes, the SRO coming from the systematic review and the EPO from the experts. In the results, I am also differentiating them by putting the outcomes suggested by the experts in red, as you will see. Next slide. For instance, in the health domain results, the highest rated outcomes here were proposed by the experts. Experts in this domain rated micronutrient deficiency as the most important outcome in assessing the sustainability of diets. The other top outcomes are undernourishment, undernutrition, diet quality, and maternal nutrition. We present here also the mean to show the average importance rate, the variance also as a way to measure the dispersion of the importance of the outcomes among the experts, the percentage change from the first round to the second round, and the ICC, which is the interclass correlation coefficient, which measures the reliability of the ratings among the experts. As you can see here, the mean value for all the outcomes indicated they are all extremely important. There is no much variance. The importance from round, or the difference between round 1 to round 2 increased for all the outcomes. And the ICC, which measures, goes from 0 to 1, where 0.9 and above is indicates excellent reliability. The ICC for this domain was 0.88, which means good reliability. Additional outcomes in this domain include type 2 diabetes, obesity, stomach cancers, and brain tumors. Next slide. The environment domain's 5 highest rated outcomes are soil health, land use driven biodiversity loss, water scarcity, resilience, and cropland use occupation. The red ones, again, are the ones suggested by the expert panel. Similar to the results in the health domain, the outcomes are highly rated with no large variance and a significant increase in importance from round 1 to round 2 for all the outcomes. And the ICC indicates good reliability. Some other outcomes in this domain include global warming, plant and animal biodiversity, land degradation, and marine and terrestrial acidification. Next slide. Results from the economic domain indicated that the most important outcome is food expenditure as a share of income, followed by the cost of a healthy diet, the cost or saving of healthcare, the cost of food production, and the cost of nutrition-related diseases. The mean value in this domain are still close to 5, so very important. The importance of the 5 highest rated outcomes here are slightly smaller than the 5 highest rated outcomes in the health or environment domains. The variance is still small, and all the outcomes increase their importance in the final round, so from 1 to 2, from round 1 to round 2. And the ICC indicates excellent reliability with a value of 0.90. Some other outcomes in this domain include total employment rate, GDP, per capita GDP, and food assistance programs, among many others that you saw before. Next slide. Here are the highest rated outcomes for the social domain: food availability, followed by food security, access to material and immaterial resources, and adequate earnings and productive work. The variance is small, indicated agreement among experts, and the importance of most of the outcomes increased, except for the access to immaterial resources, which also includes education and community services, which slightly decreased. The ICC, which indicates of 0.74, indicates moderate reliability. Something to notice here is that the highest rated outcome, food availability, is the highest rated outcome across domains. Some of the outcomes including this domain are gender equality, risk to human rights, governance risks, in ethical treatment of animals. Next slide. At the end of the study, we asked all experts to weigh the importance of the 4 domains in diet assessment. The goal of that exercise was to create potential weights for a multidimensional sustainability analysis. And here are the results. Experts indicated that 31% was for the health domain, followed by 27% for the environment, 23 for the economic domain, and 19 for the social domain. And I want to talk about why weights in this kind of analysis are very important. And that's because equal weighting in an analysis of sustainability in dietary patterns could lead to one, oversimplification of complex issues. So we cannot assume that all outcomes contribute equally to the overall goal of reaching sustainable diets. But it could also lead to misinterpretation of the opinions by the experts. Experts may prioritize environmental outcomes over social ones or vice versa, and equal weighting will flatten these differences, failing to capture the true priorities. So for instance, in the social domain results slide, I mentioned that the highest rated outcome across domains was food availability, but after adjusting the importance of the domain weights, there are several outcomes from the health and environment domains that are prioritized over the social outcome. Next slide. In conclusion, having a global representation of our panel of experts with different experiences, areas of work, and locations was key to assessing the importance of all the outcomes, the presented with the systematic review and the proposed by the experts. In relation to the domain weighting exercise, it is important to understand and be aware of the issues or obstacles when studying sustainability. And with that, I mean like the relative importance of the 4 domains and taking into account that importance and the difference. In this study, we apply weights based on the experts' insights and to have more accurate analyses that could inform policies to prioritize actions. And finally, the consensus among the experts in this study prioritized environmental and health outcomes the most, but also emphasized the importance of actively including the social and the economic domains, which has sometimes been ignored in these type of assessments. And the Delphi technique was an excellent tool for performing an expert elicitation study. Next slide. For future research, our team is already working on consumer-facing research in which we want to know if experts and consumers are aligning priorities regarding the importance of the outcomes of dietary patterns. With this new study, we want to know where consumers stand and how and where those priorities are meeting. We are already preparing a consumer survey that will be out pretty soon. Next slide. And I want to finalize by acknowledging the expert panel, who were a very important part of the study and who gave us, beside a lot of grace in the process, incredible feedback to make this study better. Here are all their names. Next slide. And also special thanks to our co-authors and contributors for their support, participation, and ideas, which made this study possible. We also want to acknowledge the funders of the Lasting Project that are here in this slide. And with this, I finish our presentation today. Thank you.
Thank you so much, Kathy. And just request Nicole and Sean to come on. So we have a few questions that have come in, and there are some questions that, as the moderator, I thought it would be very interesting to sort of explore in a discussion format with the 3 of you. So what I'd like to do is just remind everybody in the audience, please do put questions in the Q&A, though we do pick up things in the chat. Maybe I will go in first with some questions from the audience that are specific to the process undertaken. And then there is one or two questions that I'm hoping will allow us to sort of expand into a little bit of a discussion on this really critical topic. So we have Jailam Chaudhary, who has joined us, who wanted to know, in the Delphi process, did you have experts from the dairy sector and covered nutrition aspects of dairy products? So it's coming from the perspective of specifically of a product, which is dairy products. So I'll open the floor and I'll let either one of you, I'll let you decide who's going to respond. And wasn't targeted to a specific speaker here.
Thanks for the question. I'll take a stab at that, and Kathy, maybe you want to add to it. Our inclusion criteria, we're focused on kind of expertise across these 4 pillars as we defined it, and our focus is on dietary patterns, so the complete diet. So we weren't particularly screening for representation from specific commodities or aspects of animal agriculture. That said, we did have expertise in both animal and crop agriculture represented in there. But and I would have to go back and check affiliations to see if anyone had a primary occupation with the dairy industry or not. So, but our focus was more on dietary patterns rather than specific food groups in this. And again, there's a bit of a tension and a trade-off between not being able to do everything.
Great, thanks, Sean. So there's a question from Tom Van Morik about one specific outcome, food availability. And the question is, why is food availability a social outcome? I did notice that food security was also listed as a social outcome. So, and I also wanted to add my 2 questions on undernourishment versus undernutrition as hunger and malnutrition. So maybe there is something you all can answer across these different outcomes, the decision-making process, if you will.
So for a great question about food availability. So, and I will put a link in the chat for folks for a follow-up paper that we didn't actually mention here, where we further elucidated the social dimension a little bit more after we had finished the expert elicitation. Food availability, we had to think carefully about how and where to include that. And honestly, the social pillar made the most sense just in terms of the availability of food in a particular country or context. We subsequently, in the paper that I just put in the chat, have food availability as a social outcome, and have also, it's been used as a social outcome in other papers as well, under kind of the consumer group for the social domain. Food security, we actually removed from the social pillar because food security cuts across multiple pillars, and we discussed that in the paper as well. So we left food availability in, but took food security out as a cross-cutting concept.
If I can just add to that, it might seem like, oh, but if it isn't available, then you can't consume it, and then that's a health issue, or that, but remember, we're defining these things around outcomes. And so the availability of food wouldn't be, for example, a health outcome, because the health outcomes we're trying to measure are diseases and conditions. So even though there's obviously a causal chain that you might infer in many things, that the outcome of availability to us seemed best as a social measure rather than in any of the other pillars. But yeah, there's certainly a lot of, there are no clean lines on this. We're using these pillar definitions to be able to categorize these things and think about how to be more encompassing in how we think about the sustainability of diets. But we've seen people argue that it's a 5-pillar issue. Or, we could look at the UN sustainability, sustainable development goals, and, you have a few dozen there, right? So certainly how we categorize things is up for debate. The reason we went with 4 is because 4 seemed enough to be inclusive and capture all the things that we thought were important, but not so complicated as to then be confusing and difficult to keep in mind.
Great. So I think the next question is it really builds off um, the the results that you'll had. And I was curious on the health outcomes, and Kathy, this might be directed to you, was that the top 5 were pretty much outcomes that were focused on the undernutrition end of the spectrum. And not many prioritized. I didn't see the list, and maybe you made a comment about the fact that there were like sort of more non-communicable disease outcomes that did emerge. But I'm curious to know, given the increasing burden of these other forms of malnutrition across most of the countries, even low and middle income countries, I'm curious to know where these outcomes landed. Were they way down on the scale of prioritization, or they were somewhere in the middle? I know you made a comment about it, but I thought I just wanted to bring it back up and say what was the finding on those sort of NCD and overweight, obesity, and other sort of disease outcomes?
Yeah, those were very close to, I think probably they are in the top 10, top 15, obesity and all these other diseases. They make it very up in the list of 83. And the complete list with all the importance and the variants and all that will be in our paper, but yeah, they are very important rated.
Yeah, and then it's sort of this is to sort of build on to the next question that has come in from Megan O'Hearn, because it's what the question is whether there might be variability by geography or occupation type. So her question is, did you evaluate the variability in priority sustainability outcomes by expert geography or occupation type? And if so, what did you find?
We haven't done that yet. We've been talking about that within our team, actually. We don't have a balanced panel across these things. So in terms of like a statistically valid test, not all of those subgroup analyses would necessarily be conclusive, but that is something we're looking to extend a bit at to see how those break down. And I think to that previous point about undernourishment, for example, do we see overnourishment concerns having slightly higher average ratings when you're looking at higher income countries, things like that? Those are certainly of interest to us. I think that also Kathy mentioned the consumer work we're doing, and while the consumers are not experts, that will be powered for subgroup analyses as well. And so that'll be a larger part of that. And that's an explicit part of that.
And I'm just going to go along the lines of a little bit on the same sort of topic around the process and the outcomes. There is a broader question that has come in, but I'll focus on this first and then go to the broader question. Saurav Subedi is wondering why feed and fodder security is a question to South Asian countries. Despite knowing the role of quality feed in animal health, why hasn't it been prioritized yet? I don't have an answer.
I don't know that we have a good answer for that from our expert elicitation, because kind of those issues didn't come up highly. I think certainly in terms of how we're thinking about ensuring security of animal agriculture and its continued ability to produce, those are really important topics. But remember, we're focused on dietary patterns, and so that did not come up either in the systematic review or in the outcomes proposed by our expert panel. So I'm not saying that it shouldn't, but I do think that the focus on dietary patterns did abstract us away from some of these production-specific concerns. And we could also think of other phytosanitary concerns as another example in this, where you might have high concerns at some point in a production chain that wouldn't come up in our expert elicitation because we're focusing on dietary patterns. And so those wouldn't have been front of mind for the experts in the way we were eliciting those questions. I hope that's useful. I do think a more narrowly focused expert elicitation looking at different parts of production chains would get at those issues in a different way.
Great, thanks, Sean. And then there's one last question on that, again, in that line is, did clean water access come up?
Yeah, I think in the list of social outcomes, There's access to material resources, and that includes water. That includes clean water. Yeah.
And also on the environmental quality measures, water quality were also some of the proposed measures as well. So those were considered. And again, and we do have in the appendix of our draft paper that we'll be able to share soon, we do have the complete rating. So all of the candidate metrics were rated by our expert panel. We just showed the top 5 in each for purposes of time here today. But those things were rated, and we could share that as soon as we're able.
Okay. I just have to apologize. I think my internet connection shows it's unstable. So you'll have frozen a minute here. But I got most of it, and hopefully everybody got the response as well. So there's a question coming in from Gabriela Freites, and she wants to know, how do you envision this indicator prioritization exercise could be adopted by governments that are working on food systems transformation planning? This is linked to a question from Sophia Shufani as well. Is like, how do you hope the results of this research could be used or applied in industry or policy? What would you like to see it support or achieve? Very aligned questions, so maybe you all can answer in one go.
I have some thoughts I can share, and I'm sure Kathy and Nicole have some as well. So certainly one of the issues that I mentioned in the systematic review when we're introducing that is a lot of the previous studies were really focused on where data were available. And it's a bit like the old story often brought up in statistics tests of statistics classes about the drunk looking for lost car keys under the light in the parking lot, even though that's not where he lost his keys, because that's where the light is and it's easier to see there, right? So I think one of these is, what are we not measuring that we should be measuring? What are we not tracking that we should be tracking? So the extent that some of our highly rated outcomes are things that where we don't have good data, or in many parts of the world where we don't have good data, I hope that might focus resources on tracking those things. Another thing is that there have been attempts to compare dietary patterns within countries or across countries. The data limitation issue comes up there as well. But there's also a question of how should we, when we have multiple metrics, how should we trade them off? What's more important? Not everything on those lists of 200 plus candidate metrics are equally important. So we did a rating, and of course we can say, here's our top 5. Look, we have a top 5 list. Everyone loves a top 5 list. But actually these ratings allow us to weight as well. So that if we want to have something that looks like a single score metric, so we can say, well, this dietary pattern at the end of the day is more sustainable than that one, even looking across these 4 pillars of sustainability, then we can't just be saying we have 10 metrics, therefore each one counts for 1/10 of our weight. We want to be able to weigh that with something, and that's where the expert opinions come in, and separately the consumer opinions that the project we're launching there will also weigh in. So those are 2 ideas that I think would have relevance for policymakers or government or researchers doing that, as well as for private stakeholders who are looking to track their own progress. And even though we're focused on dietary patterns, it could be used elsewhere. So those are some of the things that motivated us, but I'm sure Nicole and Kathy have other ideas for application.
I'll just dovetail and say prioritization of metrics, as Sean was saying, like from an industry perspective, right? You could think about that you're going to have issues that are material for your company, but this is sort of reflecting issues that are material from a global expert panel in this space. And so you could always have it's a nice counterbalance to think about how companies' material issues relate to a broad panel of experts' assessments on these. I'll also say just very briefly, I know we're almost at time, in the environmental space, we have some kind of science-based ways of weighting different outcomes, like based on the planetary boundaries framework, for example, but that doesn't exist for these other dimensions of sustainability. So if we want to try to prioritize, this is a great way to do it.
Thanks, Nicole. Kathy, would you like to add anything to this?
No, I think I agree with Nicole and Sean. and that this is like the weighting exercise is a really good way to prioritize what, like everything is important, but we need to prioritize. So I think this is a good output of this exercise.
Great, thank you. And we are at time, and I wanted to say that the one thing that was on my agenda to talk to you all about was exactly what came out, Sean, from what you said, is the data needs around these outcomes. It's, working in low and middle income countries, you realize there's such a lack of data, and there are lots of challenges to generate that data. And I think that that was something that has come out very nicely in this conversation without me even have to ask that question. And I really feel that Megan's point of the geography and expert geography and location and the nuances of dietary patterns in those locations are going to drive what outcomes are going to be important for those locations. I think these are the two things that I really feel very strongly I'm coming away with that you all have really highlighted through this presentation. And so I really want to take this opportunity to thank the three of you for coming here and sharing the work, the part of the work that Lasting is doing and the new work that y'all are doing, going to be doing, as well as the ongoing activities. And I also want to thank everybody for joining us. And I know we're 1 minute over, so I appreciate everyone staying on longer. So thank you, Nicole, Sean, and Kathy. It's been an absolute pleasure. And have a good afternoon and evening, everybody, wherever you are. Thanks all.
Thank you, everyone.
Thank you.
Thank you.
Bye.